Hey guys, my name's Shana and I'm a nursing student at USQ, and this is my presentation on the development of my critical thinking and health and digital literacies with regards to effective communications and use of the grief and loss communication framework. This presentation is intended for first year nursing students to summarise in brief the communication requirements and developmental skills they can expect to learn over the first semester. Today I will be arguing that in the development of my critical thinking and digital and health literacies over the semester, I have found that it is essential when formulating a patient's care status and future care plan to effectively apply verbal and nonverbal communication strategies and the grief and loss communication framework to nursing progress notes. The key points to be assessed are the importance of effective verbal and nonverbal communication in developing nursing progress notes, how the grief and loss communication framework can be used to develop a future plan of care nurses would include in their progress notes, and how I have developed my critical thinking and digital and health literacies this semester. But if there is one thing I want you to remember from today, this is it. Asking if a doctor is more important than a nurse is like asking if a brain is more important than a heart. You need both to stay alive. So let's talk a little about communication. Effective nursing progress notes can be developed using both verbal and nonverbal communication. Verbal communication is spoken and includes the acknowledge, introduce, duration, explanation, and thank you framework, also known as ADET, and the introduction, situation, background, assessment, and recommendations framework, also known as ISPAR. According to Ralph and Maloney, these frameworks guide verbal communication between patients and healthcare professionals to help develop rapport and ensure safety through prompting the efficient collection and handover of relevant data evident in progress notes. In this example, although elements are missing, it is evident that the nurse has used the situation, background, assessment, and recommendations component of the ISPAR framework to effectively and clearly hand over essential data. Furthermore, in compliance to the findings of Ralph and Maloney, the duration and explanation components of the ADET communication framework have been used to involve the patient with regards to their own care, facilitating a person and family-centered approach which prompts their consent. But what's missing? The actual observation values have been omitted, and the provoking factors, radiation, severity out of 10, and time of the pain has not been addressed or provided. These absences decrease the effectiveness of the nurse's care plan and decrease their critical thinking by preventing them from identifying whether the plan has worked or caused harmful physical and emotional changes. Now, let's look at the nonverbal communication the nurse has used. Nonverbal communication relates to that without spoken words and comprises the language, movements, and gestures of the body, and the structure, legibility, and legality of writing. According to Ralph and Maloney, within nursing notes, the subjective, objective, assessment, plan, implementation, and evaluation structure, also known as SOAPI, can be used to encourage problem-solving decision-making by facilitating the identification and documentation of vital and specific information. As you can see, this structure has been used to organise the verbal information collected to develop the progress note. Furthermore, by using quotation marks to indicate a direct statement of the patient, the accuracy of the subjective data is increased by ensuring its original meaning is correctly interpreted by alternate readers. By drawing the curtains, a nonverbal cue is provided to surrounding people, requesting that they do not enter the private area and remain quiet. By allowing the patient to call her family and involve them in the situation, a person and family-centered approach has been demonstrated. Additionally, the nurse has adhered to the legal obligations outlined by Tollefson and Hillman. But what's missing? The nurse has not evaluated if the implementation of her plans have altered the patient's observations and emotional state, and has not clearly identified a working diagnosis to indicate what they believe the patient's condition is. So how exactly will the nurse know if the plan has worked, or whether it needs to be modified to provide sufficient care? Exactly, they won't. Which brings me to my next point. Efficient communication must be used in nursing progress notes and incorporated with the grief and loss communication framework to facilitate critical thinking and formulate sufficient care plans for patients. As defined by Forrester and Murray, grief and loss is the emotional responses to an experience of separation from something or someone of value. However, grief and loss is individual and may be highly influenced by a culture. This refers to the common societal behaviours, communications, and elements shared by a particular group of people. Hence, nurses must consider these factors when developing a patient's care plan, allowing flexibility of traditions to ensure respectful and person-centred care. The patient in this scenario is a 24-year-old Indigenous woman concerned about a possible miscarriage. Before adding anything to the nursing progress note, I would consider the situation and the possible effects of these cultural differences. Using ADET, I would acknowledge the patient and introduce myself. I would then ask the patient if she was comfortable with me caring for her, as I am younger than her. Traditionally, wise women and family members, particularly grandmothers, are respected highly for their knowledge and play an integral part in providing physical, emotional, and spiritual care and support for the mother and her child. Hence, the patient may feel uncomfortable being cared for by a younger nurse. Furthermore, according to McGrath and Rawson, the Indigenous culture classifies reproductive health issues as women's business, as male involvement violates their emotional, physical, and spiritual essences. Hence, I would ask the patient if she would prefer older Indigenous female staff as her primary caregivers, and if so, deliver this within her care plan. I would also need to consider sorry business, which according to Wynne Jones et al. Involves the large gathering of Indigenous community members where loud wailing and crying occurs. In order to adhere to this tradition and demonstrate family and person-centered care within my care plan, I would provide the following: a private room for the patient and her communal family to mourn without disrupting other patients, and I would also be lenient with the visiting timeframes and would not limit only direct family members from visiting her. My ability to analyse and construct efficient nursing progress notes and care plans has helped me to develop my health literacy, digital literacy, and critical thinking skills during my first semester at university. As discussed by Viccaria, Maloney, and Lockwood, critical thinking is the ability to seek, investigate, analyse, and evaluate information, problem solve, and apply theory to clinical practice. My critical thinking has expanded as I have identified how the nursing governances and concepts relate to my future nursing practice. For example, when developing the care plan for the Indigenous woman, I related the following three concepts. 1. Standard 1.1 of the Registered Nurse Standards for Practice states that nurses must use evidence-based practice to provide safe, quality care. 2. As suggested by Santana et al., by providing person-centered care through adhering to the second principle of the Code of Conduct, patient experience, health outcomes, and satisfaction improves. And 3. The Code of Ethics states that nurses must gain consent and respect their patients, their families, and their community's values, customs, and spiritual beliefs when providing care. By critically thinking and relating these concepts to the scenario, I was able to consider the patient's social and emotional well-being, requiring me to respect her values and beliefs by individualizing and gaining consent for her care plan. Overall, this would help me to improve her experience and health outcomes. My digital literacies have also developed this semester. Maloney and Farley define digital literacy as being able to search, locate, evaluate, and use information from digital technologies in order to communicate, understand, and participate in the digital world. My emerging digital literacies have included developing an understanding of cyber citizenship and digital media and its affiliation to nursing. For example, I now understand that I am required to adhere to the professional obligations outlined by the Code of Ethics, Code of Conduct, and social media policy by refraining from disrespecting and discussing myself, patients, staff, other people, and organisations online. I also understand that I must continually develop and maintain my digital literacy to remain compliant throughout my nursing career. Furthermore, by creating an online e-portfolio, I now have an easily accessible database where I can store my mandatory documents and personal information when I am applying for nursing jobs. My health literacies have also developed this semester. Chamberlain, Solon, Francis, and Mills define health literacy as the ability to promote and maintain good health through the location, understanding, and application of health-related information. My health literacy has expanded as I have learnt that a person's response to health issues is highly individual, and thus I must understand their beliefs, values, and expectations to provide person-centered and effective care. For example, in this scenario, by identifying if the Aboriginal woman had any cultural requirements, I would be able to facilitate these in her care plan to provide her with effective care that would respect and support her physical, emotional, and spiritual well-being. In conclusion, in the development of my critical thinking and digital and health literacies over the semester, I have found that it is essential when formulating a patient's care status and future care plan to effectively apply verbal and nonverbal communication strategies and the grief and loss communication framework to nursing progress notes. Efficient nonverbal and verbal communication must be used to collect and provide relevant and accurate data to develop competent and clear nursing progress notes. Furthermore, the grief and loss communication framework encourages nurses to acknowledge that grief and loss is multifactorial, ensuring the development of a future care plan that considers the patient's social and emotional well-being. By actively reflecting and demonstrating my understanding of these important elements in conjunction with my digital communication requirements, I have developed my critical thinking, digital literacy, and health literacy this semester. Efficient communication is the key to providing a patient with the most holistic care. It is the difference between an effective and ineffective nurse. So which nurse will you be?